So, hi, everybody. It's good to have you here join us in this conversation talking about the menopause. So, for those of you who don't know who I am, uh, I'm Dupe Akomolafe. I like to describe myself as a retired NHS GP who now works solely in the private sector. I have with me this evening my very good friend and colleague, uh, Dr. Tonye Wokoma, who she's a consultant in sexual and reproductive health and a community gynecologist and a menopause specialist. Gosh, it makes my title sound, it makes it makes me sound quite
We can
lazy
stop
when
there. That's fine.
you hear that. But Tonya and I go back many years. We were actually in medical school together. Some
That's fine. Thanks, Dupe.
She doesn't want me to tell you when we left medical school, but yeah, we were in medical school together. So we go back a really long time, and it's really good to have you here, Tonya. So do you want to say a few words, Tonya?
Yeah, no, thank you, Dupe, for setting this up, and thank you to Dara as well. But I think it's, as you know, it's always great to talk about the menopause, raise awareness of the menopause, discuss it. I can see Tegan has outed us and said exactly when we were in medical school, but that's all good. Um, and to do and just let women know that they're not alone, really. As you said, I'm a menopause specialist. I've been a menopause specialist for many years now, and so I do menopause day in, day out. And sometimes it feels like everyone knows about it, but I'm aware that there's lots and lots of people who are gasping for more information about the menopause. They just want to know more and how they can help themselves, really.
Yeah,
I know there's studies that show that the better prepared one is for the menopause, the better the experience is of them.
absolutely,
So that's where
absolutely.
conversations like this come in.
Yeah, no, I agree with you, Tanya, definitely. And I think sort of to kick off, I thought maybe you could maybe just guide us through what we actually mean by the menopause. I thought maybe if you give us, a sort of overview, these are the kind of questions I often get people ask.
Yeah,
What is the
yeah,
perimenopause? What's the
yes,
difference between perimenopause, menopause, and
yeah,
postmenopause? And also, if there are any differences in presentation in the
mm,
different ethnic, groups.
mhm.
So I think that might be a good point to start the conversation.
No, no,
And just to say that people should feel free to ask questions. I think, Tanya, you were happy for them to ask during
no,
the,
absolutely,
yeah,
yeah.
yeah. So feel free to ask questions. We will just have, I have Dara just on on the side who will be prompting me where the questions come in, just in case we get carried away with
Uh,
the chat. Yeah,
no,
over
no.
to you, Tanya.
Perimenopause, menopause, what do the words mean? Menopause itself, the scientific definition is 12 months after the last menstrual period. So when their periods have stopped completely, on
Right.
average in the UK, the age is 51 when periods would stop, and you can only make a diagnosis of the menopause 12 months after. So it's a
Okay.
retrospective diagnosis. Now, of course, when women are talking about the menopause, we know that they're talking about the symptoms of the menopause, and these can start to happen many years even before the menopause, even before that final menstrual period. So often after the age of 40, people can start to experience some of these symptoms. So things like the irregular periods, hot flushes, the sweats, the joint pain, the other issues that people don't talk about, the vaginal dryness, the lack of interest in sex, weird and wonderful symptoms, the hair loss, the ears ringing, those sorts of things. The things that bother women the most are the psychological symptoms, the irritability, the crying, the forgetfulness, lack of focus, lack of concentration, because that impacts on everything, impacts on work, impacts on family life. Some of those symptoms can start to happen, and everybody is different, as we've said already,
Mm.
and can start to happen in the perimenopause. And so that's why the perimenopause, which is when symptoms start to happen, and the menopause, which is when our periods stop, but women still experience symptoms. And afterwards, this period is known as the menopause and the perimenopause. And it is a clinical diagnosis. What we mean by that is that we don't really have any tests to tell
Yeah.
when people may be going through the menopause. So blood tests won't give us much information apart from making sure it isn't something else.
I think
That
that's a good point, Tanya, because I know that a lot of people go to their doctors and actually request a blood test.
Yes.
And quite often it can be quite difficult to convince women that the blood tests are not reliable. So
Mm-hmm.
I quite often, when I have them come to me in my clinic, I quite often will listen and I'll say, okay, why do you want a blood test? Go through that, because I think if you approach them and say, no, you don't need a blood test,
Yes.
instantly you sort of put women off.
Yes.
So
Yeah.
I kind of listen, and then I explain, right, I do think you're going through the menopause. The reason why I think a blood test will not be reliable, and try and convince them that blood test may well be normal and you're going through the menopause. Do you
Yeah.
see what I
Yeah.
mean?
Yeah.
And a lot of them have been to their GPs as well, who have
Yes.
said, you're not going through the menopause based on a
Yeah.
blood test.
Yes, yes. I mean, there are certain situations when you will need a blood test. So
Yeah,
some who isn't having periods and can't tell from their periods, maybe they're using some sort of progestogen-only contraception, or they've had a hysterectomy. So it's difficult to tell just by periods whether or not they may be going through the menopause. In that instance, then it may be useful to arrange a blood test. And the blood test we look at, as you know, Dupe is FSH. And especially for women that go through the menopause early, so women who have premature ovarian insufficiency under the age of 40,
yeah.
people go through the menopause, it's really, really important to make a diagnosis because we strongly recommend treatment in those women. So
I
there's
think that lends to that. There's a
yes,
question there. Can you see that? Yeah.
yeah,
About somebody asking, she's got a marina coil and
yes,
saying, yeah. Um,
yeah. If you've got the coil in, when can you take the coil out? Is it, do you still need it for contraception? Those sorts of questions. It might be useful to get a blood test done. But generally, on the whole, we don't tend to recommend a blood test because of what you said. It will come back normal. It doesn't add any further information, especially in that perimenopause time. It doesn't mean we can't treat you for the symptoms that um, women are experiencing, really.
sure, sure.
And then you were mentioning ethnic differences, and
Yes.
certainly I think our experience of the menopause is linked to cultural background, societal expectations. So there are studies that show that people report different symptoms, joint pain perhaps um, in Black people, worse hot flushes and sweats. There's an old study from America that suggests that Black Americans have a longer duration of symptoms, and the symptoms can be more severe as well. The other thing that might be different is the age at which women actually go through the
Going
menopause,
through the
when they
menopause.
stop their periods. And in minoritized groups, it's perhaps a few years earlier than the age of 51. But anything from the age of 45 to 55 is considered normal.
No, no more. Something you said there just really resonated with me. I don't know if you remember me contacting you about my aches and pains. Yeah. And I think that was the one thing that I've really struggled with. The hot flushes and things were not too bad. They were bearable, but it's the incredible backache and just joint aches and stiffness
mm,
that I've experienced. That I mean, it started with just thinking, oh, it's just a sore back, yeah, and then it carried on for weeks. Changed my mattress, changed this, slept on the floor. And I'm thinking, hang on a minute, what is going on? Yeah, but yeah, just like you said. Uh, those kind of symptoms in different ethnic groups, it's really important to identify them, that it can be so varied. That's the thing about the menopause. There's no one one thing fits all,
mm,
so it can be so varied. Yeah. And what about post-menopause? Because
mm.
because how does a woman know that she's been through the menopause, she's postmenopausal?
Yes, yeah. I mean, that's a good question. People often, one of the questions that we get asked in clinic is how long is this going to last for? Because some people perhaps don't want treatment for the symptoms. They just want to see where there might be light at the end of this tunnel. Um, and some studies suggest between 8 and 12 years, they may, start noticing that they're not getting as many hot flushes, sweats. But the thing about the symptoms of the menopause or the experience of the menopause, that it's linked to our lifestyle. It's linked to the symptoms can overlap with other conditions as well. So again, it's important to ultimately be as healthy as possible. That will hopefully help us manage with the symptoms as best as we can. You're in the post-menopause once your periods have stopped. So everybody after that 12 months is
Right.
post-menopausal.
Okay.
You continue on that journey. I describe it as a journey. It's not an event. It's not
Till
that
death,
one point,
till
point.
death do yours part.
So it depends on how you're feeling. It depends on what symptoms you're getting. It depends on how you're coping. Some people leave work. So the symptoms can really impact people. Some people leave work, some people retire. So it's all, I mean, it matters not just because it's something that 51% of the population through. It matters because there is, if we don't support women in the menopause, there are a huge number of women in the workforce. Lots of them will retire, will reduce their hours, will leave work because of the impact of the symptoms on the menopause. It matters because it impacts on families. It matters because it impacts on individuals themselves. People lose self-confidence. They lose their self-esteem. And that's why it's really, really important. And we know, you and I know, that there's some communities that don't come forward to
Yeah,
seek help for their
absolutely.
symptoms. And that's what we want to encourage
Yeah,
as well.
absolutely. Yeah.
At
I just
menopause.
want to mention that please feel free to drop your questions. As the questions come up, we will try and answer those questions and delve into them as they come up. Um, the other thing I was also just going to mention, I mean, obviously October 18th is Menopause Day, is the day we recognize as World Menopause Day. And it's really interesting that this year the theme is lifestyle medicine, isn't it?
Mm, mm,
Lifestyle medicine. So it'll be nice for us to probably talk about the importance of lifestyle medicine in the menopause, because often people see menopause and they talk about hormones,
yeah,
HRT, but also the importance of the other things with menopause. There's a question here. Um, so, what can I take for sore feet? Has gotten worse over the last few months. Very sore in the mornings. I'm 50 and wondering if HRT would benefit me. So I think, thanks for that question, Lisa. It sounds like Lisa is not on HRT yet, but she's experiencing some symptoms. I haven't heard of sore feet. I don't know, Tonye, in your experience, I'm sure you've heard of all sorts of different symptoms. But yeah, is there anything that,
soft feet is actually really, really common. A lot of women talk about achy feet, tired feet, heavy feet,
So
sore feet,
still part of the achiness. Yeah.
I always suggest that they make sure there's nothing else going on. There's no other inflammatory health condition that they could have. So they go to their doctors and get a full MOT and
Okay.
make sure cholesterol's fine, make sure thyroid is fine. Often weight loss, which is coming back to the lifestyle that we would want to discuss, because it affects everybody, whether people are overweight or not. But if we can, I hope, as you know, Dupe, I describe menopause as this three-legged stool. And if any of the feet are wobbly, you will feel wobbly in the menopause. So one bit is lifestyle, diet, exercise,
Yeah.
stress, hydration. All that is hugely important. And even the sore feet, if one isn't drinking enough, if one is dehydrated, that can make things like that worse. The other bit is the mental health, which on that stool, I sort of describe that stool as mental health, society, culture, mindset. What is the expectation of people of the menopause? Because in some cultures, they don't believe it's something where you need to use medicines to treat.
Yeah. Yeah.
And absolutely, you and I know that a woman doesn't have to go on to hormones, but that's not the only treatment of the menopause. And then the final leg is the hormones, and hormones can be absolutely really beneficial, but it's to make your stool steady and to have a good experience of the menopause, it's optimizing all those legs, really, all the factors of the menopause that impact on the menopause experience.
Yeah, no, absolutely. There's a question about weight. Weight loss or weight gain has any effects on menopause? Can menopause cause weight loss or weight gain? And I think, correct me if I'm wrong, Tonye, but I think generally when women get to that menopausal age, we have this redistribution of fat, and certainly that's where we see a lot of abdominal girth increasing, with with everything is going down south, as we say. And I know some people have also been very worried about whether or not HRT causes weight gain, but I think it's more the menopause rather than the
Yeah,
medication. Yeah,
our metabolism changes, men, women,
absolutely.
as we age. So people often say, oh, I'm still eating the same thing. We can't continue to eat the same thing. We have to adjust for our age as well. Ensure we're eating the right amount of protein, ensuring that we're eating the right kind of food, ensuring that we're getting exercise, because we become more sedentary or tend to as we get older. Not everyone, but we're often in jobs where you're sat in front of a computer. So you're not moving as much as perhaps we should be. So even the advice of 150 minutes of exercise a week
A
of,
week.
of
Yeah,
moderate brisk walking,
yeah.
just alone
30, 30
helped.
minutes, five. Yeah.
Yes, help to improve things. But it is and menopause. What was your question again?
It was about weight gain, and I think
Yeah,
you
and
pointed out the metabolism changes. But I think the other thing that we forget is that during our earlier years, we're running around children. You see, by the time we get to the age of menopause, most of our kids are grown up. They're more settled, more individual. So we slow down ourselves. Do you see what I mean? We slow down because we don't have to run around kids anymore. So we slow down, and mentally we forget that, you know, that slowing, the running around kids that you did 10, 20 years ago, it's exercise. You see, even though it might not be structured exercise, but it's, activity. And I think a lot of us, if you count how many steps we take in a day, it's probably only about 2,000, because we're
yeah,
sat at a desk most of the time. Um, Now that a lot of us are working from home, it's even worse. You see, you're not getting out, and all. So, like you said, you can't overemphasize the role of exercise, which helps with the weight, general well-being. I mean, for me, I go walking every day. So
Mm.
I walk 6 kilometers every day. It's not easy,
Mm.
but it's something I have committed to doing. And now, because I do it so regularly, it's become part of my lifestyle, you see, such that if I don't do it, I miss it. My body misses it. I feel more achy. So it's become mandatory that I do it. Yeah. So, yeah.
I, I really like your posts, Dupe. So I don't know if you want to mention your 5-step plan for.
Yes, yes, yes. So, I mean, last, so I think it was, Tonye has already said Tonye again has already said when we graduated. So last year we met up, about 30, 40 of us met up to mark our 30 years post graduation. And just before that, I had been struggling with some excess weight, and I thought, you know what, I need to do something. I'd been telling myself I needed to do something for months. Yeah. And it just didn't come off. It didn't. So graduation suddenly dawned on me, 6 weeks, graduation is coming around. I'm thinking, nah, I've got to look my best for this. I mean,
Absolutely.
post-grad
Yeah,
reunion rather is coming up. I've
reunion
got
is
to.
coming up.
So I
Yeah,
started,
nothing like a school reunion to jumpstart.
so that was my motivation, it was my motivation. So if you look on my website, on my clinic website, you see where I posted the 5 steps, to that I did, and really it was about, what's my expectation, what was the raising expectation. So I my the reunion was my motivation. So I set myself a high expectation. That was the reunion. I calculated I had 6 weeks to the reunion. I had to get 6 kilos off. So that was a target of a kilo a week. And I started, I got into it. And then, for me to make sure that I could achieve this, I made myself accountable. So actually, I posted it on the reunion group,
Mm.
but you guys thought it was a joke, But for me, I was really serious. I posted it, and I got myself, I spoke to my husband, I spoke to Baba, and I said, look, this is what I need to achieve. I need to lose weight. I've got 6 weeks and I need to go. I actually wanted to go from 82 to 76 kilos. And I thought, wow. So I started, so it was diet, it was exercise, and whatever I could do, and every week every day I weighed myself. And the more I told myself, the more I did it, the more I saw the weight come off, the more I believed that I could do it, you
Mm.
see. So that's why I say, that belief, became conviction, so I kept going. And I mean, I think it was, yeah, a week to reunion, I realized I didn't quite make 6 kilos. I made 5 kilos. So I thought, yeah, that not bad. I rewarded myself, and to be honest, was it always easy? No, it wasn't. There were times where I did, I just cheated. Yeah. But I always said to myself, look, yesterday was a bad day, just move on. Yeah, and
Yeah,
that was it. So on my website, I've shared the 5 steps that carried me through. But yeah, going forward,
yeah,
since then, I've achieved that, and gone further. So you can't overemphasize the lifestyle, and I'm really pleased that this year's theme is about lifestyle. I'm really
yeah.
pleased that, because I think people think that the answer, the solution to menopause is HRT.
Yeah, you showed up for yourself, didn't you? But you looked at all the other things
Yeah,
around.
yeah,
HRT is absolutely really, really beneficial
Yeah.
and can help with symptoms, but it's doing all the other
It's a
work because we know
combination.
that being overweight can contribute to symptoms. We know that smoking can contribute to symptoms. So it's all these things that can make symptoms worse.
Yeah.
And you feel old, you feel achy, you lack the motivation, and it becomes a vicious cycle.
Yeah.
So you've got to sort of start somewhere.
Yeah, absolutely. And also, it'd be nice if you kind of, because I know there's always a lot of questions about HRT. Lisa had asked about HRT. It'll be nice maybe to just, I know HRT is a minefield on its own, but it'll be nice to maybe just give a bit of an overview of HRT. I mean, I would proudly say I am on HRT. Yeah. And yes, it'll be nice just to just give a
Yeah.
broad overview.
So, I mean, what happens to if a woman comes into clinic to see me or to see you is we listen, we take a history, we talk to the woman, we understand exactly what it is that's bothering her the most. And then we take a really good history. We understand if there's anything in the family that might predispose her to any sort of familial genetic conditions. Ask about things like blood pressure, heart disease, clots, etc. Those sorts of things. History of any cancers in the family. It's all those things that we ask about because that will tailor the kind of medication or the kind of treatment that that woman will receive. And then we go on to discuss what the options are because not everybody wants to go on to hormone
Yeah.
replacement. Absolutely. So we start with the lifestyle, which we've talked about, and then we go on to there's herbal remedies that people can use, but we always say use it with caution.
Portion.
Make sure it has a kite mark on it, a tide mark, because we don't have as much experience with that, and also the in terms
Research.
of studies, we don't have as many studies available with that. But some people use some different supplements, which they say is helpful.
Yeah, some people swear by things.
Yes, yes, absolutely. And then there's non-hormone medication that people can use because not everybody wants or can go on to HRT. And that's really, really important. I always say I'm here to walk alongside the woman on her journey. It's not about saying you must do this or you must, use this, have this treatment. And then, of course, we come on to hormone replacement. And hormone replacement, there's a whole variety of treatments that we've got in our arsenal that come under the umbrella of hormone replacements. But before I forget, I just want to talk about vaginal estrogen
Yeah.
because it is relatively safe and
Hmm.
it is effective at treating what we call the genitourinary syndrome of the menopause. So the vaginal dryness, the irritability, the bladder overactivity, all those symptoms that to do with the pelvic floor. Vaginal estrogen targets the pelvic floor, can help with painful sex, and can certainly ease things down, in the vagina. And we do use it even in women on HRT. In
Yeah.
some, we advise that they go on to vaginal estrogen. But even if a woman didn't want to use hormone replacement, they can usually have some vaginal estrogen if
Estrogen.
they're
And
experiencing.
it's safe for
Yes,
prolonged number of years, isn't it?
absolutely, absolutely. Now to HRT, which is what your question was. We've got
Yes.
tablets, we've got patches, we've got sprays, we've got gels. The main difference between something that's swallowed, a tablet, or to something that's absorbed through the skin is the risks that go along with HRT.
Hmm.
And it's about putting things into context. So it is a medicine. It does carry small risk, and it depends on what a woman's background risk is. And the risks we tell everyone about includes the risks of clot strokes, which is mitigated, it's reduced if you have something that's absorbed through the skin. So the patches, the gels, the sprays, all these other options apart from a tablet. And then there's the risk of breast cancer, which everyone is scared about.
Scared
But
of
again, the risk is it,
minimum
it needs to be put into
into
perspective.
context. Yeah.
Yeah. And so that's the discussion that we have with people in clinic. Now, if a woman has her womb, if she hasn't had a hysterectomy, there's two hormones that she must have in her HRT: the estrogen, which is what
Mm-hmm.
the body is wanting back, and the progesterone,
Progesterone.
which is there to protect the lining of the womb. And it's really important to have both of these hormones. So some of the preparations come as the two hormones in one, some come separately. The important thing is that you must have the two together. And then very briefly to mention testosterone replacement, because more and more women are asking for testosterone now. The evidence in the literature is that testosterone helps with low sexual
For
desire
sure.
or a lack
Yeah.
of libido.
And
But
that's the only license.
and that's what it's licensed for. Not We don't have licensed preparations available in our country, but we do use it off license, testosterone replacement, after we've monitored the bloods, etc.
Yeah.
But again, it's about exploring what else might be going on.
Yeah. Did I hear that androfen is testosterone will be licensed next
I'm not
year?
sure. I'm not exactly holding my breath, but I think it may be happening at some point in time.
Okay. Somebody has asked specifically, does
Yeah.
HRT cause weight gain?
Ah, HRT itself, there's no evidence that
Yeah,
it can cause weight gain. Now, I always say to women that hormones treat people differently and people respond to hormones differently.
absolutely.
So some people get water retention, some people. So we always talk about the risks with HRT. Of course, it has huge benefits. It helps to treat these symptoms that we've mentioned already.
Yeah,
But there can sometimes be side effects. And that's why you need to see a professional to be able to tweak your HRT regime or preparation, to be able to adjust it, to be able to change it if needed. But usually we say, no, it doesn't cause weight gain. It's about
okay.
diet and exercise and seeing what else that one can do.
And I think you raised the point there. I think that one point is that it's a very individualized journey. Yeah,
Yeah.
so there's no one size fits all. Every woman's journey and treatment, management of the menopause is different. So
Yeah.
because your friend or your colleague had this medication, it doesn't mean it's going to work for somebody else. And I think it's important, because in this day and age of technology, of information, women have read all sorts of things and come and say, I want this.
Mm,
Yeah, I
mm,
want, because they've heard that uterogestern is good. Yeah,
yeah.
I want this. So I think that's there's a point to say it's very individual.
And there's a whole array of different things. And if one thing doesn't suit, then something else might suit better. But ultimately, what it is that when we're prescribing HRT for a woman, you will prescribe the sort of algorithm in our heads is what is safe, what will be effective, and what's convenient, what fits into your lifestyle. So we talk about oral HRT, and a lot of people are using something that's absorbed through the skin. Now it may be that oral HRT is completely suitable for you because of your background history.
Yeah, yeah. Yeah.
That's it's all that to consider.
Somebody has asked that how can men best support their partners during menopause? I think that's a very good question. Um,
I think it ranges from partners being really sympathetic to people complaining that their partners don't believe that it's a problem. And in that instance, in the first instance, a woman needs to recognize or understand that this might be what is going on. And then she can start to educate her family, go to the doctor to seek help. And sometimes you can just Google the green climacteric scale, which is
yeah,
scale of all the symptoms, and sitting down with a partner perhaps to say, look, this is what I'm experiencing at this point in time. What women say to me is they just want somebody to listen often. And sometimes maybe that's not what they're getting from their partners. But I think that comes from possibly a lack of understanding as to what may be going on. So it's having
yes.
a conversation, really.
And I think you raised a good point. Women want partners to listen, and I think partners always want to solve a problem.
Mm.
I think that's the general thing with men. Men instinctively want to solve a problem, but it's not a problem they can solve, you see. So I think, yes, that sympathetic approach is so, so important, and maybe even just listening to talks like this together. Do you see what I mean? I personally I look forward to the times where talking about menopause is not talking about women.
Yeah.
I look forward to the time we're talking about menopause is talking about couples, because they go through it together. You see, you don't leave your wife to go. After all, when your wife is pregnant, how come you come together? It's our baby. Do you see what I mean? She's carrying our baby. So I look forward to the times where partners don't see it as a female problem. That's your problem. So that will be interesting.
Absolutely. So it depends. I think partners, managers at work, children, people can be supportive during this time by lending a listening ear, understanding what might be going on
Yeah,
the woman, and helping her through this period, really walking with her through this journey.
yeah, yeah. No, absolutely. Okay. And I was going to another thing. Is there any question there? Any other question? Something else I was going to ask is, what do you think? How do we reduce the stigma and encourage open conversations? What do you think?
It's continuing to talk about it. If we don't raise awareness, educate people as to the impact, because what you still hear is, so what?
Mm,
And you still hear, oh, our mothers didn't do anything about it. What's the big deal? What's all the fuss
yeah.
about? Um, but we know everybody's journey is different. We know some people have such debilitating symptoms that it, hugely impacts on their lives. But with the right support, they can carry on working. But unless we continue to talk about it and educate communities, educate people, sometimes we're our own worst enemies. We're the ones
Mm-hmm.
that say, oh, it might be this or it might be that. But the other thing about reducing the stigma is that this is more in some communities. It's finding out. We need more research in how people want to receive information, how people want to, what sort of approaches that they require, because we know access to care can be tricky, can be difficult.
Mm-hmm. Mm-hmm.
But where do we go to find people to offer this education, whether in faith communities, whether in traditional ethnic minority communities? Unless we talk about it.
If you could change something about how society views menopause, what would you need be? If if there was something.
Menopause now, I think, has become quite polarized. We've talked about already, how do we remove stigma? But there's a group of people that think that menopause, that it's become over medicalized.
Over medicalized, yeah.
And it's finding that balance. Menopause is very nuanced. It's finding that balance. So it is something that people need to know about.
Mm-hmm.
So we need to educate people. We need to normalize the conversation. So if it's one thing we change in society, it's not for or against. You can either use HRT or you might not want to use HRT. Absolutely fine. But
Yeah.
are we having the conversation?
Mm-hmm.
And that's what we need to be having. We need to normalize the conversation. We need to make it something that we talk about. We need it to be something that's not divisive almost in our society.
And I
And
think in workplaces as well, it's really
yeah,
important for it to be part of what employers sort of offer. Just the support, signposting. I'm not saying that they need to be menopause champions themselves. You know what I mean, the employers. But I think that more and more companies should be able to signpost their employees to places where they can get support and help. Yeah.
And that happens, but that's not happening around the world.
No.
It's happening more and more. Um, in the UK, for example, but other countries, it's not the same. So it's even just talking about menopause in society. It,
Okay.
it's a natural transition. It's a time of life that actually we should be absolutely celebrating. But if somebody is experiencing symptoms that they're finding challenging and difficult, there is appropriate help out there.
Okay. And my dear friend Monica has said, can you expand more about postmenopause, what to expect, and is HRT not necessary anymore? So that's a really good question. Yeah.
HRT, I mean, I have older women who are many years into the postmenopause coming to ask about HRT now because they're just finding out about HRT. HRT is necessary for as long as it's needed. The guidance says there isn't any arbitrary time limit for the use of HRT. So the next question is, okay, so how do we know we still need it? Because of course, if you're on HRT, I wouldn't expect you to be getting those symptoms of the menopause. We've answered the $1 million question. How long do the symptoms last? Who knows? And so it's different for everyone. A woman should take HRT for as long as she needs it. I always say if things change, if your medical history changes, if one develops other conditions, if there's any reason why you may choose to come off HRT, choose a time that's a little bit quiet, not when you're moving house or changing jobs. Try and do it in a gradual fashion. There isn't any evidence to suggest stopping it
Yes.
abruptly or weaning off it makes any difference. But I always suggest just do it gradually and see if your symptoms, do it slowly, see if your symptoms come back. What the postmenopause comes with it, so you may still continue to experience, apart from period stopping, continue to experience the flushing, the sweating, the joint pain, the vaginal dryness. Some of these symptoms will ease off. So the flushing and sweating, often they're triggered by activity, by stress. That may settle down if someone leaves work, for example. But things like vaginal dryness, for example, will get worse unless it's treated.
Mm,
And that's why it's hugely important, because there's so many people suffering in silence
yeah.
when effective,
That,
safe
yeah.
treatment.
And I think the other thing to say about that postmenopause as well is where you said is for as long as the woman needs it. But I think also is to emphasize that HRT also has protective um, is protective over bone health and things like that. So I always remember, my mother going through, I shared this with you before, Tonye, my mother going through a surgical menopause and where she wasn't actually put on HRT. So she went through a surgical menopause, I think when she was probably in her early 50s. Surgical menopause means that she had a hysterectomy and therefore, and her ovaries were removed. Therefore, she had menopause. She went into menopause. She went into hospital premenopausal and came out menopausal, which was horrible.
Mm,
And she wasn't put on HRT. This was many, many years ago. And it wasn't until 10 years later, actually, when she saw a consultant, that he put her on HRT. And this was for bone health.
mm.
So, just buttresses your points that there's really no time limit. It's for as long as it's needed, for that health reasons. So somebody is saying that about emotional moods that can last for days. Can you suggest anything to help? They all fall down emotional. So I think again, really, it's about speaking to a menopause specialist, having a conversation. It's not the kind of thing, it's not something you just want to brush over right in this conversation. You really want to have the face-to-face conversation with a specialist where they go through all the symptoms, make sure that there's nothing else, and we can just put it down to the menopause. There are other things that often, family issues, social issues, the things that contribute to our mental health, our moods, our emotions. Yeah. So making sure that those things have been properly dealt with. And then if HRT is appropriate, that can be discussed, but also lifestyle, all of those things contribute. So everything we've been talking about, really. Would you agree with that, Tonye?
No, absolutely. On the one hand, most of the symptoms that people experience around the age of the menopause and the perimenopause would be because of fluctuating hormones and a fall in our estrogen. But I always caution people that not everything is attributable, it's because of the menopause.
Mm.
So I agree completely. But going back to your previous point, Dupe, about the benefits of hormone replacement. So apart from treating the symptoms, it can help protect our heart, especially if we
Yeah.
have under the age of 60, and protect our bones. So again, it's really important if somebody goes through a surgical menopause, as you've explained, because of surgery, for whatever reason, or somebody has a medical menopause where they've had treatment, often because of cancer,
Mm-hmm.
and they go through a menopause as a result of that, to get treatment, which, if it's appropriate, to go on to HRT, especially if they have the treatment at an early age.
Yeah. Good, good. So I'm just going to look at, there's one more question before we round up. I'm conscious of time and I don't want to take your time. So my period didn't show up for 6 months, and I was so glad. And then I had started my menopause because I wasn't experiencing any of the other symptoms mentioned until the red devil appeared 2 months ago. So am I pre? So that's, that time, am I prepping towards it? So that's called perimenopause. So like Toyin defined, you cannot say you've been through the menopause until 12 months after your last period. So it's a retrospective diagnosis. So if you still have periods, that red devil that came up, it's still perimenopause. Isn't that right, Toyin?
No, that's absolutely right. But this raises the point of, if somebody has gone for 12 months without periods and then they have a bleed,
Yes.
red flag. That is important. It's important to see somebody. And this is because if somebody has what we call postmenopausal bleeding, so bleeding 12 months after the last menstrual period, that's needs to be investigated because it could be a sign of cancer. Most
Yeah.
people don't have cancer, but it needs to be looked into because of that. But if you're within the 12 months, I'm afraid that can happen, because what happens to
Okay.
periods is sometimes the cycles can shorten as women go into the perimenopause, and then they can start to get longer and less frequent, and the periods get longer and longer, and you think, it's all over, it's done with, and then
Yeah.
it appears again.
Yeah.
So you can do that until you go for a period of 12 months
Yeah.
without
Yeah.
any.
So I'm just going to clarify what Tanya has just said, because I know now that you mentioned the word cancer, people's ears are going to. So what Tanya has just said is, once you have been through the menopause, defined menopause, as in over 12 months, you haven't had a period for over 12 months, you can assume that you are menopausal. Now, after the 12 months, if you then, by any chance, start getting some bleed, you should get that investigated to exclude any pathology, when we say pathology, anything abnormal, to exclude anything abnormal, because in the worst case scenario, in most women, it's nothing. And I've had that, just if that reassures people, I've had that. And I went to see a gynecologist and I had a scan done, and that was it. There was nothing. Yeah, and then I had it again after another 2 years or so, and I didn't bother. I couldn't be bothered to go for a prolonged referral and all. But if what Tonye is saying is that if that happens, get it checked, go and see a specialist, get referred, make sure they do a scan, make sure they exclude anything else. The worst case scenario is it can be something nasty, and we don't want to miss that. Okay. All right. I think if there are no other questions, Tonye, do you have any final words for us? I think this has been really informative. I think we need to do this more often. Definitely. We've been talking about it for years. We didn't have to wait for Dara to be the one to push us to just get our act together. But I think we need to do it more often. I think the more people are informed, the more confident they feel. And the more confident you feel, and you take control of your health, you take control, and which is what we should be doing as we get older. I always say that menopause is it's a stage. I define it as not a stage to pause in life. As a woman, it's a stage of a rebirth. A rediscovery of who we are. Especially because this is where kids have left home. It's there's a whole life ahead of you, new, exciting. It should be new and exciting. So I don't know if you have any final words of encouragement for us, Tonye.
I think you've said it all. It's an opportunity to just take stock.
Yeah.
Take a look at where we are in life, and not just with our health, with everything. But if we pay into our health bank, we have many, 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 many years to live in the post-menopause. We'll reap the benefits as we go along. So it's hugely important. Take a step back, know what your numbers are, what your weight is, what your blood pressure is, what else might be going on. It's post-reproductive health. It's not just about hormones. It's about your whole health journey. So just use this opportunity of the perimenopause and the menopause
So
to do something.
yeah. So we will share this session. We'll post it online. Please look out and look out for my tips on our website. Follow Tonye and I on Instagram. We'll be sharing lots and lots of tips, not just about the menopause, but just about general health, women's health in particular, which is the area we're most passionate about. And we'll definitely get back together and discuss something again more topical. I don't think there are any more questions. So thank you so much, Tonye, for taking time to be with us. And we I've really enjoyed the session and chatting with you. And I'm sure we'll catch up.
Thank you, Dupsy. Thank you, everyone. And
All right.
see you again soon.
Take care. Take care.
Bye.
Bye bye.